Now the panel is open for the discussion and the questions. If you have any questions, you may ask now. Well, I will ask question from you, sir, from the Bacha, sir. Nowadays, the ladies are more career oriented. They postpone pregnancy. If they're going for a fertility preservation or any other form of a fertility preservation before marriage or after marriage, is there a particular age limit or there's a better age to do so?
So as I told earlier, the female fertility declining. The decline is pretty faster after 30 years. Slower after 30, after 35 is very fast. So I would say better do it before 35. But again, there can be individual variation. So normally before doing the procedure, we will do an assessment of the female. That is to assess the ovarian reserve. If the reserve is okay, we can wait a little. But before getting things worse, it's better to freeze. I would say less than 35 years the best, at least before 35 years.
Any other questions?
good evening everyone මම මගේ පහසුවට සිංහලෙන් කතා කරන්න මේ ලංකාවේ මේ වෙනකොට මේ මද සරුභාවයේ තියෙනවනේ දරුවන් නැති එක මේක ලොකු ප්‍රශ්නයක් වෙලා තියෙනවා. එතකොට මේ පෞද්ගලික රෝහල් වලින් ගොඩක් මේ සඳහා ප්‍රතිකාර කරනවා. ඒතකොට ලොකු වියදමකුත් යනවා. ඒතකොට රජයේ විදිහට මේ වෙනුවෙන් යම්කිසි ක්‍රියාමාර්ගයක් මේ වෙනකොට අරගන්නවාද එහෙම නැත්නම් රජයේ විසින් මේකට දෙන දායකත්වය මොකක්ද කියලා දැනගන්න මම බොහොම කැමතියි. ස්තුතියි.
To translate that, those who can't understand the Sinhalese, what he asked is, in Sri Lanka, we have the assisted reproductive technologies are mainly in the private sector. So the people who are spending a lot of money, because everybody can't afford that. Because of that, he's asking whether as a government, are there any policies or any plans has implemented already to help those people who are in need for the assisted reproductive techniques?
මේකට සිංහලෙන් උත්තර දෙන්න. මේක ඇත්තටම සබ්ෆර්ටිලිටි අපි මුලින්ම ට්‍රේන් කර එකන තමයි ડોක්ටර් බාචා. ඒකට ඒ ට්‍රේන් කරන කාලේ තමයි අපි රජෙන් ඉල්ලුවේ මේ අපුහුණු වෙලා එනවා. ඒ නිසා එනකොට අපි මේක IVF කරන්න යුනිට් එකක් ගාල්ලේ හදන්න කියලා යෝජනා කළා. නමුත් අවසනාවකට එකම රජයකවත් ඒක ප්‍රයොරිටි එකක් උන්නේ නැහැ. ඊට පස්සේ අපි හිතන්නේ දැන් අවුරුදු 7-8කට ඉස්සෙල්ලා ඊටත් ඉස්සෙල්ලා මම හිතන්නේ කාසල් ස්ට්‍රීට් එකේ හොස්පිටල් එක හදන්න කියලා සියලුම දේ යෝජනා කළා. නමුත් තාම රජයේ රෝහලක ඒක එස්ටැබ්ලිෂ් කරන්න හැකියාවක් වෙලා නැහැ. අවසාන ප්‍රශ්නේ තියෙන්නේ ඇත්තටම දැන් මේ ගොඩක් heart attack එකක් හැදුනහම මිනිස්සු හිතනවා ඒක තමයි ඒක ලොකු රෝගයක්. ඒකට ඉක්මන් ප්‍රතිකාර කරන්න ඕනේ. ඒක නමුත් කවුරුත් මේ subfertility කියන එක ඇත්තටම ඒකෙන් suffer කරන අය තමයි දන්නේ ඒකේ තියෙන වේදනාව. ඇත්තටම ස්පෙෂලි Tamanට ප්‍රතිකාරයක් තියෙනවා නමුත් කරගන්න සල්ලි නැහැ. ඒ වගේ අවස්ථාවකද මොකද කරන්නේ කියන එක අපි හැමදාම දකින ප්‍රශ්නයක් නේ. Tamanට ගෙවල් ලුකස් කරලා තියෙනවා සමහර තියෙන දේවල් විකුණලා යනවා. ඉතින් ඒක අවසනාවකට එකම රජයකවත් ඒක ප්‍රයොරිටි එකක් උන්නේ නැහැ. තාමත් අපි හිතනවා.
මාත් ආයි සිංහලෙන් පොඩ්ඩක් කියන්න ඒ ගැන ඔබතුමාගේ ප්‍රශ්නෙට. ඔව් දැනට තත්ත්වයේ ගත්තොත් IUI වගේ ට්‍රීට්මන්ට් නම් අපේ කාසල් සීට් එක කතා කරොත් තියෙනවා. ඒක සම්පූර්ණයෙන්ම නොමිලේ ලබා දෙනවා අපි එහෙ. IVF එක ගත්තොත් දැනට බිල්ඩින් එක හදලා ඔල්මෝස්ට් ඉවරයි. අවුරුදු 2000 අපි කොවිඩ් කාලේ පටන් ගත්තා 2019 මුල් ගල් තියලා ඊළඟ දවසේම මොනවාද ලොක්ඩවුන් එකක් ආවා. ඊට පස්සේ ඔක්කොම නතර වෙලා දැන් කොහොම හරි බිල්ඩින්ග හදලා ඉවරයි. දැන් පොඩි ෆිනිෂර්ස් තියෙන්නේ. දැන් ඉක්විප්මන්ට්ස් තමයි ඕන. ඒක ලොකු ප්‍රමාණයක් මුදල් ඕන. තාම ඒක අනුමත වෙලා නැහැ. ඒක තමයි අල්ප තත්ත්වය. ඊළඟ ප්‍රශ්නේ එන්නේ අපිට ඒක නෙවෙයි. පටන් ගත්තට පස්සේ ඒකට වැය වෙන රිකරන්ට් එක්ස්පෙන්ඩිචර්ස්. ඒ කියන්නේ කාල මුදල් ප්‍රමාණයක් ගෙඩන් වෙනවා. ඉතින් ඒකත් ලබා ගන්න ක්‍රමයක්ත් එක්ක තමයි ඒක එන්න ඕන. ඉතින් ඒක අපි ගත යුතු තීරණයක් නෙවෙයි. ඒක මම හිතන්නේ පොලිසි මේකර්ස්ලා ගත යුතු තීරණයක් කියලා මම හිතන්නේ. ඒගොල්ලෝ කොහොමද ඒක කරන්නේ කියලා කාටද IVF දෙන්නේ? මොන වගේ ක්‍රයිටීරියාස්ද පාවිච්චි කරන්නේ? මොකද ඒක විශාල ප්‍රශ්න ඉස්සරහට තියෙනවා. අපි හදිස්සියෙන් ලංකාවේ එවැනි දෙයක් නොමිලේ ලබා දෙන්න ගියාම මොන වගේ කට්ටියට දෙන්නේ? කවුද ඒක කියන්නේ මෙඩිකලි අමතරව අපිට අනිත් දේවල් බලන්න වෙනවා. මොකද සමහරවිට අපිට එනවා කාසල් එකට සමහර අය එයාගේ ෆැමිලි බෑග්ග්‍රවුන්ඩ්ස් ගැන ඒවත් වැදගත් වෙනවා. මොකද හස්බන්ඩ් කුඩු එහෙම ගන්නව නම් එහෙම මොනවා එහෙම ගන්නව නම් එවැනි පරිසරයක හැදෙන ළමයෙක් හදන මේ වගේ දෙයකට අපි දෙනවා. ඒක අහතු ප්‍රශ්න ඒක සමාජයේ කතිකාවක් යුතු දේවල්. මොකද මේක දෙන්නේ අපි ආණ්ඩුවේ කිව්වහම ජනතාවගේ වදුම් මුදල්. ඉතින් ඒ වගේ දෙයක් කරද්දි කාටද දෙන්නේ? ඉතින් එවැනි දේවලුත් හිතන්න ඕන මම හිතන්නේ.
Good evening. I have the question. Can you explain the IVF legal framework in the Sri Lanka? I have the second question. If you can answer in this question, you can answer what is the method having in the Sri Lanka for spinal cord injured couple?
Legal framework at the moment, there's no legal regulations at all. But very recently, I think after about, this is from about 2012, after a long struggle for about 12 years, we have been able to bring up at least some guidelines to IVF centers so that they are bound to give some ethical and rational treatment procedures, practice some rational treatment procedures when they provide services to the public. So that is the start. I know, like, we were actually planning to establish something like a HFE, that is Human Fertilization and Embryology Authority, like in UK. But unfortunately, that involves a lot of changes. But for a start, we have got the ministry to actually, we have drafted guidelines, and now it's perhaps within the next 3-4 weeks it will be out for the IVF centers to practice. For the people with spinal cord injuries, there's no established treatment practice. So again, with regard to that, is again we'll go with the kind of injury, and of course at the end of the day, if it's a male, we are looking at getting a sperm sample. So there are various techniques that you can adopt to do that, and of course they might have to go for some kind of assisted reproduction treatment if they want to achieve a pregnancy.
So I currently did my undergraduate study research on subfertility, but I'm a demography student. So I did how subfertility affects how the treatment seeking behavior of currently subfertile married women. So I tried to address the demographic factors, socioeconomic, cultural factors, but this was a very small study. So I just want to know, what are your comments about the treatment seeking patterns and behaviors among women, specifically women in Sri Lanka? Do they have fertility before they come to treatment? Because in my experience, they had no idea about subfertility unless they tried to approach several treatment seeking options, because like it was, they had to go for like 3 or 4 treatment seeking options to pick one, and most of them were very culturally biased. Their ideas revolved mainly around the cultural factors. So what are your ideas about?
I think with regard to public awareness and knowledge with the kind of treatment options that are available are very limited. Of course, it depends on what kind of level of education and knowledge about sort of education level and all. And the other thing is, now if you look at the woman who wants a child, they do anything to have a pregnancy. You just need to get a weekend paper and look at the advertisements that are there with regard to various kinds of treatments options that are available for fertility. Unfortunately, these are also not regulated. We know they are 90% they are not true, and also kind of misleading information that is rampant. I mean, none of the treatment procedures like IVF is 100% successful, and you can mislead people, and also they spend a lot of money, and people go from one place to another. That's a very common thing. So if they go to Dr. A and in 3 months if they don't get a pregnancy, they go to Dr. B, then Dr. C, and sometimes we see the same thing being done over and over again, and they age, and they go, when they are about 39, 40 only, now they realize there are other options, and that's a very common problem.
I think social media plays a lot of big part, because people are basically oblivious as to what they need, and most of the clinicians that practice, they are unaware of what should be offered. So they just give them what they are comfortable with. Again and again they undergo the same treatment without realizing that they need to go to the next step. That is, I think, what Prof. Kalwaraj was trying to elaborate also. And social media plays a big role. They ask in these social media forums that are there, and there are people who might not have the best interest of the patient in mind. So they will just direct them to a particular individual or a particular center. So that we see that happening a lot, and ultimately they might not get what they really deserve. Now there are 2 things that have happened in the recent past. One thing is the code of conduct that Prof. Kalwarachi was talking about. We have devised that, and it's to be inked by the ministry and the government, so that that will come into play in recent future, in the very near future. So that includes that the people who are providing these services will be duty bound. Who should be there, what level of knowledge should they have, and who should be in charge, and what should be offered like. We have formulated an association of reproductive medicine and surgery specialists. Dr. Bacha is the president of that. So that will also take these things into account, and we plan to address these things as well in time to come.
Just one thing to add. I agree with you that most of the people have that kind of a treatment seeking pattern. But I have also noticed that there are people who are far ahead of us as well, because there are Facebook groups who discuss about different doctors, different treatment types, whether it works or not. So that part is also developing, or it's happening rather slowly. But I think women are also trying to think about what kind of a treatment they really want. So I think we need to encourage that happening, so they will, at the end of the day, will have a better treatment. Yeah.
I think a place like FPA would have a big role to play in terms of, because fertility treatment is a big business. If you really look at it, people exploit. What we see mostly is exploitation of subfertile couples. That is the sad part of it. Knowing that your treatments are not going to work, people keep on giving various medications, and sometimes the cost, I mean, we see sometimes the drug that is costing 5 rupees being sold at 5,000 rupees. So that kind of unfortunate exploitation of this situation is there, because people will do anything to have a pregnancy. So that's the sad part of it.
Yeah, that's why it basically you need regulation here. So here we don't have regulation right now. So we're trying to do it. Our politician also doesn't understand this thing probably. So I think that is the way forward. Have a proper regulation. Then these unethical practices can be eliminated. And then all the awareness programs will be all well regulated. Correct information could be provided to the patient. Yeah, that should be there.
So as you know, there is a big demand in the public for the subfertility treatment. So as you discussed and as we aware, we know in our government sector, there are only limited investigation and limited treatment opportunities are there. So but now in some places in Sri Lanka also, there are some sort of higher treatment facilities, and there are higher places with all the facilities to do some sort of treatment for the patient, for the parents willing to have and affordable for those services. My question is to the college or to the Ministry of Health, is there any guideline to the government medical service, government doctors to refer them to those places, how much they should go these investigations, and after that what is the investigation like that, if there's any guideline to follow?
So that's, I think, what Prof. Kalwarachi was saying. The guideline or the code of conduct that we help to form explains the whole cycle from the beginning to the end. And also it explains who are the people who are qualified to practice IVF, and that all the centers should be registered in the medical Ministry of the Health, and they have to follow a certain guideline that is issued by the Ministry of the Health. So there will be hopefully a committee who's looking after this center. They might visit those places maybe once in a while. That's our plan. We need to have some kind of that is similar to HFA that's in UK. In the beginning, it may not work, but hopefully with time, things will get better.
What your question you are probably was asking us, whether there's a referral process.
Referral process
Yeah.
and any
Yeah,
guide.
unfortunately, there's no standard practice in the referral process, except, I mean, it's haphazard. I think some people would do refer to knowing, because the thing is, fertility treatment, you might start at the very basic level, and you must have a plan for the couple, because there's no point going on treatment for 10 years and with the same kind of treatment. So if you do practice basic treatment for maybe 6 months, 1 year, if you don't get pregnant, you must go to the next level of treatment, like doing induction of ovulation and IUIs and things. If it doesn't work within 6 to 8 months, then you must offer at least to the couple, okay, this is available, at least the next level treatment is available. And that kind of educational process and making them aware of available facilities and tell them where to go, it's not happening in a standard way. It's very haphazard.
You might not be aware that subfertility or infertility is a recognized subspecialty under obs and gynae, and there is a training program for that. And there are people who have trained and come back after their overseas training. Dr. Milhan Bacha was the first, I am the second. Then there's another lady in Kandy, Dr. Deepani, and Udari is the fourth. So we are manning stations, and people know about us. It's a matter of referring. So even in the government sector, they can refer us. At least even if the facilities are not there, we can at least counsel the patient as to what to be done and make a management plan for them so that they know what to expect as they go through their treatment journey. If that is not happening, that's unfortunate. Because we are there. Dr. Baja is at Castle Street. Although I have joined the university, I am at Kaluboil Teaching Hospital. Udar is at Ragama Teaching Hospital, North Colombo. Deepan is at Kandy. And hopefully Gayani will go and take goal in the next couple of weeks. So there are people. So it's a matter of referring to those qualified people.
Thank you. That will be end of our mini session. That's the last session of the conference. Thank you very much for your patient listening and collaborative discussion. Thank you very much.